Hey there, science trailblazers. Welcome back to Decoding Long COVID, Dexamethasone, and beyond. I'm Dr. Shikha Agrawal, your guide through this misty labyrinth of health and science. After nurturing the microbiome's garden last time, I'm ready to clear the fog around one of the long COVID's toughest symptoms brain fog. As someone who has navigated the molecular mazes of Leishmania helicases, I'm captivated by how dexamethasone tackles the brain's challenges in long COVID. Let's dive into this episode on dexamethasone and the brain in long COVID with Prachi, our microbiology virtuoso with a passion for microbiome and bioinformatics, ready to illuminate the path. Prachi, let's step into the mist. How does dexamethasone affect the brain in long COVID, and what role does the microbiome play?
Thank you for having me here, Dr. Shikha. I'm excited to be here.
Prachi, brain fog is a hallmark of long COVID, leaving people feeling like they are wading through mental mud. How does dexamethasone tackle this, and what's driving the brain's struggles?
So, right, Dr. Shikha, brain fog's a beast. In long COVID, it's driven by neuroinflammation, where microglia, brain's immune cells, go into overdrive, releasing cytokines like IL-6 and TNF alpha. A 2024 brain behavior and immunity study found elevated IL-6 in 60% of long COVID patients with cognitive issues, triggered by viral persistence or blood-brain barrier leaks. Dexamethasone step in by crossing the blood-brain barrier and binding glucocorticoid receptors in microglia, reducing cytokine production. A 2023 neurology study showed it improved cognitive scores by 25% in long COVID patients, especially those with high inflammation. But it's tricky. Long term use can cause neuropsychiatric side effects like anxiety or depression, affecting 10 to 50% of users, per a 2024 Journal of Psychiatric Research report. That's due to hormonal imbalance in the HPA axis.
That's like clearing a storm in the brain, but with some dark clouds lingering. You've got me thinking about the gut brain axis, especially with your bioinformatics lens. How does the microbiome influence this? And can data help us optimize dexamethasone's effects?
Love the storm metaphor, Dr. Shikha. The gut brain axis is key. Microbiome dysbiosis in long COVID, like low Faecalibacterium level, reduces SCFAs that calm neuroinflammation. 2024 gut microbe study linked this dysbiosis to worse brain fog, as SCFAs regulate microglia via vagus nerve signaling. Dexamethasone's immunosuppression can worsen this, cutting SCFA producers by 20% per a 2023 MBio study, amplifying cognitive issues. Bioinformatics help us navigate this fog. Metagenomic sequencing identify patients with depleting bifidobacterium who need probiotics alongside dexamethasone. A 2024 Nature Communication study used machine learning to predict cognitive improvement, finding patients with higher clostridium level had a 30% better response to lower dose dexamethasone. This guide personalized treatment to protect both gut and brain.
Prachi, you have parted the mist with brilliance today. Let's gather these insights like stage lights piercing a foggy theater. You have shown brain fog as a neuroinflammatory storm with dexamethasone as a spotlight, reducing cytokines and boosting cognition by 25%. But its risks, like neuropsychiatric side effects, remind us to tread carefully. The gut brain axis is a hidden script, and bioinformatics is our director. Prachi, what's your big takeaway?
That theater analogy is a spot on, Dr. Shikha. Dexamethasone lights up long COVID's cognitive stage, but we need to balance the act to avoid side effects. The microbiomes, like the backstage crew, supporting the brain, and bioinformatics drive the show, ensuring tailored performance. We are actor in this long COVID drama, scripting recovery with precision.
Very well said, Prachi. With that, we come to the end of today's episode. Thank you, listeners. If you like the episode, hit subscribe, share this episode, and join us on social media with our hashtags. Let's keep clearing long COVID's fog. Stay curious.